Hello, my name is Angelina Hoyer, and I'm going to be doing my presentation on Down syndrome. Everyone has 46 chromosomes. We inherit 23 from our mother and 23 from our father. However, in Down syndrome, there is a third 21st chromosome. So this is what causes Down syndrome. This can lead to developmental and intellectual delays, physical characteristics that are present with Down syndrome, we'll talk about those, and then many comorbidities that come with Down syndrome. Down syndrome had been depicted in early art, literature, and science, but it was not until the late 19th century that Langton Down published a description of a person with Down syndrome and became the father of this syndrome. In 1959, Jerome Lejeune identified it as a chromosomal condition. He found that there were 47 chromosomes in each cell. In 2000, scientists identified and cataloged each of the 329 genes on chromosome 21, which helped motivate research from this point onward. There are three types of Down syndrome. The first one is non-disjunction, and this is most commonly what they're referring to when someone says trisomy 21. So this is an error in cell division. The embryo has 3 copies of chromosome 21. The pair of 21st chromosomes falls into a separate sperm or egg cell, and an extra chromosome is replaced in every cell, replicated in every cell. This has a 95% occurrence rate. The second one has a 4% occurrence rate. It's called translocation, and this is when the total number of chromosomes is the normal 46. However, there is an additional copy of chromosome 21 that attaches to another chromosome. It's often 14, and you can see that in the picture on this slide. The third option is mosaic, and this is a mixture of 46 and 47 chromosomes in the body's cells. The 47 ones contain the extra 21st chromosome. This is only 1% of cases, and they do tend to have fewer characteristics than the other types, just because they do have some normal cells. Down syndrome occurs in all races and economic levels. The prevalence is really increased with maternal age, so as the mom gets older, the chance of her having a baby with Down syndrome increases. As you can see on maternal age 35, it's 1 in 350 chances. That is the trend now to have children later, so we do expect to see an increase in Down syndrome. The phenotypic features of Down syndrome. So they do have a growth failure and cognitive disabilities, a flat back of the head, abnormal ears, many loop fingerprints, a palm crease called a simian crease, unilateral bilateral absence of one rib, an intestinal blockage called a duodenal atresia, abnormal pelvis, diminished muscle tone, this is very common, a broad, flat face and slanting eyes, epicanthial eye folds and a short nose with a wide bridge, short and broad hands, a small and arched palate with a big wrinkled tongue, which is sometimes protruding, dental anomalies, and then a large important one is the congenital heart disease, which we will talk about, an enlarged colon, and big widely shaped toes. Heart abnormalities are very common with children with Down syndrome. 40 to 50% are born with these problems. The most common types are the atrioventricular septal defect, which causes a mixing of blood between the atriums and the ventricles, and separate atrial or ventricle septal defects can occur. A persistent ductus arteriosus, tetralogy of Fallot, which is 4 different abnormalities combined. The respiratory system is so closely related to the heart that it's also often affected with these. There is a growth of blood vessels in the lungs that's limited, so that increases pressure and blood flow to the lungs. Sometimes they need respiratory treatments. You can see that baby has a nasal cannula on. Clinical presentations with Down syndrome can vary dramatically in severity. When they're young, they can have ADHD, inflexible behaviors, chronic sleep difficulties, and fatigue. School-age children may have depression, social withdrawal, anxiety, OCD, regression in cognitive skills, and sleep difficulties. And adults can also have the anxiety, depression, social withdrawal, and regression in social skills. They can also have dementia. Down syndrome is the most common identifiable cause of intellectual disabilities, with 15 to 20% of disabled population. They also can have vision and hearing impairments, and many meet developmental milestones later, like talking and walking. There is variable penetrance and expressivity with Down syndrome in appearance, cardiac concerns, etc. However, there is nearly 100% penetrance with the specific cognitive disability and neonatal hypotonia that these patients have. IQ scores can vary from 20 to 69 or more. All people with Down syndrome have an extra portion of the chromosome 21. However, the cause of this is still unknown. Maternal age is the biggest correlation that we have. However, 80% of Down syndrome babies are born to mothers under 35, just because that's when people are having babies the most. No research has shown any indications of environmental or activities during pregnancy that can lead to this syndrome. Diagnosing Down syndrome can happen prenatally or after birth. Prenatally, we can screen to estimate the risk via a blood test or ultrasound. This is non-invasive and highly accurate. To diagnose prenatally, we need to do the chloronic villus sampling or an amniocentesis. These are both blood tests and they have a risk of miscarriage because they are so invasive, but they are 100% accurate. After birth, the physician will order diagnosis if they notice some of the physical features. Karyotypes confirm that is a mapping of all of their baby's chromosomes, and we would see the third 21st chromosome. Or they can do a FISH test, which also looks for 3 copies of chromosome 21, and this is a newer test and it's become quicker to confirm. So either one, the karyotype or the FISH, is what we do after birth. Unfortunately, there is no cure to Down syndrome, but there are treatments. Infants need to undergo a heart echo immediately if there is a problem with perfusion, breathing, or a murmur. Otherwise, they'll all receive it at 2 months of age. They should immediately start with speech therapy, as many times these babies have a difficult time eating. Some are unable to eat enough by bottle without tiring that they'll need a gastrostomy tube. Physical therapy should also begin right away to help with their tone and muscle development. Down syndrome children may not say their first words till age 2 or 3, so they continue working with speech therapy and physical therapy. Occupational therapy will help children develop independence with opening and closing things, playing with toys and stacking, and working with knobs and buttons. The Individuals with Disabilities Education Act regulates early intervention and mandates schools provide appropriate education for these children with disabilities beginning at age 3. Management for adults with Down syndrome includes screening and prevention just like everyone else. However, they do tend to have some of these diagnoses that might need treatment. So we screen them extra for thyroid disease. They can have hypo or hyperthyroidism, diabetes, hearing loss, depression or obsessive compulsive disorder, obstructive sleep apnea, spinal cord compression, dementia, or periodontal disease. It's important to always approach the individual with Down syndrome and not their caregiver first when screening for these disorders. Society has been improving on integrating people with Down syndrome into the community. However, this isn't always in an area we can improve on. So acceptance is so important to these individuals. Many have mild to moderate cognitive delays, which would allow them to still participate in school, workforces, and recreational activities. So we really just need to work on accepting, including these individuals, and being kind. Decreasing depression and social fear would come along with this. It's really important, and just having support for those parents and individuals with Down syndrome and connecting to them to support networks. So as far as social considerations go, we need to accept these individuals and help them integrate into the communities. Financial struggles for these families are very common. Diapers longer in these children because they take longer to potty train. There are numerous hospital appointments and co-pays that these families will have to pay. The therapy appointments for speech, physical, occupational, and mental therapy. And then medications and medical equipment are a necessity in these patients. They will need a caregiver most need a caregiver at all times, so parents are unable to return to full-time work. Disability benefits, the intention is to help, but sometimes they easily get absorbed into total family income, and this is another reason they struggle. Luckily, there are many organizations to try to help these individuals. Disability living allowance is given from birth to age 16. Then there's the carrier's allowance and the 1619 bursary fund for children 16 to 19. And then personal independence payments are given to disabilities with Down syndrome, people with Down syndrome, and this replaces the disability living allowance, so it's from age 16 to age 64. These are my references, and if you want to visit the National Down Syndrome Society.org for more information, and thank you for listening.